Okay, true crime addicts, today I have a story for you. What is the connection between the death of an anesthesiologist at her home from a heart attack and 11 other patients from the same facility in northern Dallas, Texas? It's a huge puzzle the investigators are trying to figure out if it was just a coincidence or someone out there to cause harm. So on June 21st, 2022, anesthesiologist Dr. Melanie Casper, 55 years old, and her husband were both feeling ill. Dr. Casper decided to treat her dehydration with an IV bag she grabbed from the surgery center where she worked as an anesthesiologist. But almost immediately after inserting the IV into her vein, she started suffering a serious cardiac event and died. Her husband grappled with the fact that she just had a heart attack, but it was kind of weird because she was a very healthy woman and she could sit on her bicycle trainer for hours and never have any issues. So about 2 months later, on or around August 24th, at Baylor Sky and White Surgical Care Center in northern Dallas, an 18-year-old male patient experiences a cardiac emergency while he's in his scheduled surgery. The team was intubated and transferred to a local ICU. Since this was such a rare occurrence to happen, hospital investigators decided to do a test of the fluid from the saline bags. The chemical analysis of the fluid from the saline bag used during his surgery revealed the presence of epinephrine, a stimulant that could have caused the patient's symptoms, excuse me if I butcher this, bupivacaine and lidocaine. So after the incident with the 18-year-old at the surgical center, investigators decided to take a further look into past incidents at the surgical center and found that they identified about 10 additional unexpected cardiac emergencies that occurred during otherwise unremarkable surgeries between the months of May and August 2022. So after looking deeper into these cases, investigators believe these occurred on or around like May 26th to 27th, June 27th, July 7th, 15th, and 18th, and August 1st, 4th, 9th, and 19th. During these 10 incidents, medical personnel were at least able to stabilize the patient only through the use of emergency measures. So at the same time that the young gentleman, the 18-year-old, was having a medical emergency, at the same time on August 24th, Dr. Melanie's autopsy report that was completed, it concluded that she died of an accident involving the bupivacaine toxicity and it was found in her bloodstream. Now, bupivacaine, sorry I'm butchering the name, is not a drug of abuse, but is rather a common nerve block agent used in regional anesthesia procedures. Investigators consulted with medical personnel and concluded that it is highly unlikely that a medical professional knowingly injected herself with the bupivacaine intravenously. So now with these incidents, investigators decided to return to the surgical center and obtain 4 IV bags from the warmer device. Just so we all know, a warmer device is an incubator to get bags warm, so they're given like that when they're administered. 2 of those 4 bags that were believed to have been tampered with, after inspections, was found that they showed small puncture holes in the clear plastic packaging that the IV bags are encased in. The bags with the puncture holes appear to have been physically tampered with, as there is no explanation to why a supposedly sealed bag would have a puncture hole in the packaging surrounding it, so it raised a lot of red flags. So chemical testing of those bags revealed epinephrine, which is a potent pharmaceutical stimulant that, according to health professionals, could easily cause the cardiac symptoms that the young gentleman experienced if it had been administered unintentionally or intravenously. The fluid in the IV bag also tested positive for the bupivacaine and lidocaine. The IV bag was a lactate ringers saline solution not labeled to contain any of those medications. The 2 other suspected compromised bags obtained from the facility warmer's device also tested positive for the bupivacaine and the lidocaine. Now, with all these incidents involving Dr. Melanie and the other patients, investigators suggested there was a pattern of intentional adulteration of the IV bags, with a total of 10 unexpected cardiac emergencies. So who could be causing all these incidents at the surgical center? Who's going to be responsible for this? So investigators looked at all the anesthesiologists and concluded that the only anesthesiologist who didn't have a patient suffer from any of these potential poisonings was a doctor named Dr. Raynaldo Rivera Ortiz Jr. But this alone doesn't mean that he is responsible who did it. But investigators decided to look deeper on why he hasn't had any patients who have suffered any of these issues. So let's look at Dr. Raynaldo. Who is he? So Dr. Raynaldo Rivera Ortiz Jr. is an anesthesiologist in Garland, Texas, who specializes in anesthesiology. He graduated from the University of Texas Medical Branch School of Medicine in 1989, and he has about 34 years of experience. And he worked at the Baylor Sky and White Surgical North Dallas and other surgical centers in the area. But Baylor Scott was the main location where he made most of his earnings. But there's a deeper past into Dr. Ortiz. He has a bit of a troubled past. Now, according to documents from the State Medical Board, Ortiz has a history of violence toward women. He was arrested in 1995 over accusations of assault causing bodily injury to a spouse. The victim was Ortiz's wife, who later divorced him. The pair settled for an undisclosed amount of money. Then in September of 2005, the board says another female filed an emergency protective order against Ortiz, claiming he assaulted her. Now, 9 years later, on December 2014, Ortiz and his then girlfriend, the mother of his child, got into an argument in front of their neighbor, Roxanne Bogdan, and he was arrested for alleged assault. The ex obtained a protective order against Ortiz, and Bogdan testified on her behalf. He blamed the neighbor for their split, according to prosecutors. But about 4 months later, in April 2015, Bogdan heard a loud sports car pull into Ortiz's driveway and then gunfire and her dog yelping. Yep. As she ran into her backyard, she saw her dog's chest covered in blood, according to court papers. The dog survived, but Ortiz shot her dog. Ortiz has at least 3 Corvettes whose engines have a distinct sound, according to the records. So in June 2016, a Garland County junior found Ortiz guilty of cruelty to an animal. Of course, he deserves it. He was sentenced to 25 days in the Garland County jail and given a $4,000 fine. I honestly think he should have gotten more time. I'm not for harming animals. The judge also ordered him to take anger management classes. Well, it sounds like the guy needed it. And pay $505 for restitution for the injured dog's veterinarian bill. Now, on November 2020, Dr. Raynaldo was the anesthesiologist at another facility, during which one of his patients suffered a serious complication during the anesthesia. In April 2021, Ortiz relinquished his medical staff membership and all his clinical privileges at a second facility, and that's because the board was coming after him to suspend him, so he decided to get ahead of the board. On August 19, 2022, Ortiz entered into an agreed order with the Texas Medical Board related to the November 2020 incident at the second facility. The Texas Medical Board found that Ortiz did not respond to the patient's issues in an appropriate manner, failed to document the critical events, and did not recognize the patient's inadequate oxygenation and ventilation. Ortiz agreed to a number of conditions, including submitting to an extensive ongoing monitoring by a board-selected physician at Ortiz's expense, retaking a medical jurisprudence exam given by Texas. And the medical board asked for him to complete 16 hours of continuing medical education credits and paying a penalty of $3,000. Now, on top of that judgment, there's another non-public disciplinary inquiry currently pending against Ortiz at the main facility. Specifically, it is investigating of an incident that happened around May 19, 2022, 2 days before the incident started, during which a patient stopped breathing under Ortiz's care during a routine procedure. According to a review commissioned by the facility, Ortiz deviated from the standard of care by failing to maintain the patient's airway and failing to document critical aspects of the incident. Conduct of a type that also noted during the November 2020 incident. So these two incidents are matching. So Baylor Sky and White personnel told authorities that Ortiz was informed of the disciplinary inquiry against him related to the May 19th incident that we just talked about on or around about Tuesday, May 24th, and that first cardiac incident in the pattern under investigation occurred on or around about Thursday and Friday, May 26th and 27th, later that same week. Ortiz appeared at another meeting related to the May 19th incident on or around June 22nd, 2022, and there was a suspected cardiovascular incident the following week on or around Monday, June 27, 2022. So we can see here that there's about a pattern of like, is Dr. Ortiz going on a retaliation because the facility is disciplining him for his actions, and he's taking it out on patients, innocent people. So here's a few more things on those patterns. Ortiz went on vacation from on or around July 23rd until on or around July 28th, 2022. No cardiovascular events occurred during the time he was on vacation, but the incident started occurring again right after he returned from vacation on July 29th, 2022. The first suspected incident thereafter occurred on or around about August 1st, 2022. So it's weird, he's on vacation, nothing happens, comes back, another cardiovascular incident at the same facility. So Baylor Scott and White personnel told authorities that Ortiz had access to all the IV bags during the time periods in question, as well as the drugs that were positive in the chemical testing. Again, those drugs are not controlled substances. Luckily, there was surveillance footage that was obtained from Baylor Scott and White. That surveillance footage takes place on or around August 2nd, 2022. Any earlier footage is unavailable due to the automated deletion feature of the digital video recorder attached to the surveillance system. But the video in question that was collected and reviewed by agents directly from the facility system shows that it implicates Ortiz in the August incidents that are under investigation. So here I'm going to break down what happens in that surveillance video. The surveillance video shows that on August 4th, 2022, at 11:35 a.m., Dr. Ortiz exited operating room 5 and walked toward the warmer device with an IV bag in his hand. No one else is visible in the video from the OR hall at this time. In the footage, Ortiz walked slightly past the warmer, then turned and quickly placed the IV bag into the warmer, like he was trying to hide it from anybody seeing him do that. After he placed the IV bag in the warmer, he looked both directions in the operating room hall and then quickly walked away. A short time later, Ortiz opened the warmer and looked inside, then quickly closed the warmer. A 56-year-old female at the same time was in operating room number 1 for a scheduled cosmetic surgery that was going to occur around the same time that Ortiz placed the IV bag in the warmer. At around 12:11 p.m., video shows a nurse obtaining an IV bag from the warmer for her surgery, for the 56-year-old female surgery. Surveillance video then shows that no other staff members accessed the warmer between the time Ortiz accessed the warmer and the time that the staff member obtained the bag at 12:11. After the IV bag was placed, the 56-year-old female developed severe hypertension and cardiac arrhythmias at around 12:50 p.m. She was given emergency treatment and transferred to an emergency facility. Now, same things happened on camera as we just talked about on August 9th, 19th, and 23rd. We see Ortiz trying to sneak something into the warmer, an IV bag. He walks away. No other staff member are seen grabbing any IV bags for a while there, for a short time period. A nurse walks in, grabs a warmer device, takes it to the OR where a patient is having a surgery procedure, gives it to the patient, and then a few minutes later, that patient is having a cardiac arrest. So we can see where the applications are that whatever Dr. Ortiz put in the warmer device was tainted. And now here's another more little suspect thing from Dr. Ortiz. During one of his surgeries that he was the attending anesthesiologist, a nurse stated that she retrieved an IV bag from the warmer device to use during his surgery. But Dr. Ortiz strongly refused to use that bag and physically waved the bag off. The nurse did state that she recalled that event as very unusual. The nurse also stated that around the same time Ortiz went to retrieve his own bags that happened during the procedure he was performing. The nurse said that it's very unusual for a doctor to do. That's why the nurses are there to help and assist doctors for these small tasks. And doctors don't usually obtain their own IV bags. So with investigators obtaining surveillance video, his history pass, statements from doctors, and the coincidence of timing, and possibly retaliation for his discipline, Dr. Ortiz was arrested on September 14th and faces federal charges of tampering with a consumer product, causing death, and intentional drug adulteration. He was ordered to remain in custody without bail while awaiting trial. Jeremy Johnston, who's the former director of the surgical at the Dallas Regional Medical Center, said that a number of work-related complaints was high for a single doctor to receive in a 3-year period. Johnston, who testified on the court order, said he personally felt afraid of Dr. Ortiz after the doctor screamed at him and chest bumped him during a dispute at work at the Dallas Regional Medical Center. Johnston also said he's retaliatory and he's aggressive. Johnston, who now works at Baylor Scott & White's North Garland Surgical Center, where Ortiz also used to work, is scared to death. He said that he's worried that Ortiz one day might come out and shoot at them, and he's scared for his own wife and kids. Ortiz has a public defender, but prosecutors argue that the anesthesiologist is a flight risk. He also allegedly had about $7,000 in cash on him at the time of his arrest, and he owns a $1.3 million home and 5 luxury cars, including a Corvette and 3 Mercedes-brand vehicles, and has tax liens for owing the IRS about $1.5 million. So about October 5th, 2022, which is 3 months ago, a federal grand jury has indicted the anesthesiologist on 10 charges in cases where he's accused of injecting heart-stopping drugs and IV bags, killing 1 doctor in June and injuring at least 10 other people. The grand jury in Dallas returned the indictment last week against 59-year-old Raynaldo Rivera Ortiz of Plano. Ortiz was indicted on 5 federal charges of tampering with consumer products and 5 counts of adulteration of drugs. Dr. Ortiz faces up to a life in prison if convicted of federal charges poisoning IV bags with various pharmaceutical drugs last summer at Baylor Scott & White Surgical Care in North Dallas. Let's all hope the justice is done for Dr. Melanie Casper and the 10 other people who were injured and could have died. Again, Dr. Ortiz is innocent until proven guilty, and we'll see where this case takes us. And once that happens, I will provide an update on whether Dr. Ortiz is innocent or guilty. I'm not going to jump to conclusions. I'm not going to do death by media, but I think we could see all the evidence and let a jury decide on that. Well, thank you for listening, and if you like, please subscribe and follow. Hit the YouTube button, subscribe, and I appreciate everybody.